Everybody, I'm Dr. Stephen Phillips, and I'm here with another short video. Today, I'd like to talk about emotional trauma. It's such a common thing in my patients. I'd say about half my patients have really significant emotional trauma, and I think it's to be expected. I went through my really bad case of Bartonellosis when I was in my 40s. I was already a doctor in this field of zoonotic infections, and I came through it highly traumatized. And you have to figure that if this happened to me with the resources that I had and the knowledge that I had, how can the average person get through this unscathed? I think it's not possible. Our bodies are taking us on a ride that we can't get off, waiting for the next shoe to drop. The breadth and the extent of these illnesses are nearly impossible to communicate to people who haven't been through it. And I remember when I was at my sickest, I really wished for telepathy. So the people that I care about, if I could just show them, have them feel what I was going through, even for 30 seconds and no more, because I couldn't communicate the hellishness of the experience. And on top of that, when patients go to their doctors and they're ignored or made to feel like they're making it up or looked at like there's some mystery case that they'll never figure it out, it's extremely traumatizing. And then add to that the regular life traumas that we go through on top of that. What about when people lose a loved one, a death in the family, or marital problems, or one of the many stresses, financial stresses that so many patients on disability go through? So I'm a firm believer that we have to treat the whole person, and it's not just about prescribing antibiotics. So there's a therapy called EMDR, and it stands for eye movement desensitization reprocessing. We have a whole section devoted to it in Chronic, the book. And it's a therapy that is generally quick, it's drug free, and it's highly effective. It's not always easy to go through because it does have people relive their traumas, but with an experienced therapist, the success rates are very, very high. So I just want everybody to feel empowered by this information and hope that it's helpful for someone out there. Thanks, and I'll see you next time.